Are you a runner and you're experiencing knee pain, especially pinpoint knee pain on the outside of your leg during or towards the end of your runs? There's a good chance you're experiencing something that's called IT band syndrome. Hi, my name is Stefan and I'm a chiropractic intern at Health Fit Chiropractic and Sports Recovery. And today I'm going to talk about what the most common causes of IT band syndromes are, and I'm also going to run you through the assessment and treatment we'll do at the office here. One of the most common causes of IT band syndrome is muscle imbalances along the leg. And so I would have the patient go through a functional assessment where we would look at the gait of the patient. And then I would also have them do a one-legged stance where I'm mainly looking if there's any hip drop, which would indicate that the outside hip muscles are weak, or if the knee caves in, which is very common with this IT band syndrome. Next, I would have you stand here on one leg and rotate to both ways, and that's to check out the integrity of the meniscus. And then I would have you come down and lay on your back for me, please. And the first thing I would do is check the ligamentous integrity of the knee. And if there's any issues with either the ligaments or the meniscus, we would refer them out for an orthopedic consult. If not, then I'm going to palpate for any muscular imbalances. I'm mainly going to palpate the IT band. I'm going to look at the outside of the leg, right where the IT band is. The IT band connects the TFL muscle, which runs from the outside hip down to the lower leg, outside of the leg. And sometimes this IT band syndrome gets tight and compresses against the outside of the leg, which can cause that pain that you're experiencing during your runs. So I'm going to palpate there, feel for any adhesions or tightness. And then I'm also going to have you come forward and then bring your right leg to your chest. I'm going to have you pull your leg, go back. And here I'm going to assess if there's either hip flexor tightness or rectus femoris tightness, which here his leg is not quite at a 90-degree angle. So we can see that there's some tightness in that quad muscle, which is also very common with IT band syndrome. So we would work on that muscle to release some of the tension. So what we do in the office, stainless steel GRASTON tool, and we will kind of work out the adhesions in the IT band syndrome. So we would have the patients in shorts, and we would really work that IT band all the way from the distal insertion at the knee all the way up into the hip, since this can get tight with this syndrome. And the most common reason why this IT band gets tight is because the outside hip muscles might be weak, and the IT band then and the TFL muscle is compensating for the weak glute muscle. So we would work this IT band and also anterior to it into the quad, because with him previously we saw that his quad is tight, so we want to release tight muscles, and then also behind on the outside hamstrings as well. And then what we also do at the office is a technique called ART, and we would do this for the quads and the IT band. For the IT band, I would have his leg in a fully flexed position, pin that IT band on the outside of the leg, and then bring his leg into full extension and really work through those adhesions in that distal IT band. And then we're also working on the quad. I would have him in a shortened position here, pin down the quad, and then lengthen the muscle and really stretch that tight quad. And finally, with a condition like this, since it's most commonly from weak outside glute muscles, it's very important to give the patient exercises to do at home to strengthen this outside hip. With a condition where the IT band is overactive and the glute med is weak, we really want to emphasize on strengthening the glute med with our exercises. So 3 really good exercises to do to strengthen your outside buttock muscle is one, going to be laying against the wall. Your top leg is going to be, your top heel is going to be touching the wall. And then you're going to lift up that leg and you're going to really feel like you're working with your buttock muscle here, the outside of your buttock muscle. And we want you to do 3 sets of 10 leg lifts this way. Then we can do what's called a clamshell. So again, we're still on our side, working my right side now. And then we're gonna have the knees superimposed on top of each other, and we're really just gonna open up with the right leg. And if that's too easy, and again, you'll feel that in the outside buttock muscles. And if that's too easy, you can use a band around your thighs and do the same exercise. Then we're also gonna go into a glute bridge, where one leg is straight, the other leg is bent, and then from here we're going to push up. And we really want to make sure that our pelvis is level and not dropping in like this, because this again would show that there's weakness in that right hip muscle. So here we want to have the pelvis level. We're going to push up, hold 2 to 3 seconds, go back down. That's 1 rep, and we're going to do 2 sets of 10 reps. And then finally, we're going to go into an oblique position again to strengthen that outside leg muscle. We're going to be with knees in a 90-degree position. Top leg is superimposed on the bottom. And then we're going to push up from here and hold this position for 30 seconds or 60 seconds, depending on how strong you are. And we're going to do 5 reps of these 30 seconds on both sides. And then that's for 2 sets. So with knee pain, we really want to work on stability. So one really good exercise is a supported airplane. So what we're going to do is we're going to stand on one leg and have our hand supported somewhere, either if it's a wall or something like this. And then what we're going to do is we're going to open up those hips, keeping that stability, really only have minor support, and then go back to neutral. And then we're going to open that up 10 times for 2 sets on that painful knee. If this is too easy, you can go to an unsupported stance, this one leg stance just like this. And then we're going to, again, open up all the way. Really make sure the knee doesn't cave in like this. The knee needs to stay straight. So we're going to open up here, back to neutral, and that's 1. And we're gonna do 10 repetitions that way for 2 sets. Then I can't emphasize enough how good terminal knee extensions are for people with knee pain. So what we're gonna do is, let's say I have right-sided knee pain, we're gonna have a band like this. And then really what we wanna do is get the knee to where you have good tension on the band, and then extend it and really lock that knee out as much as you can. And we're gonna do 10 knee extensions this way, and we're gonna do this for 2 sets as well. And then finally, we're going to do a stretch for your hip flexor. This last exercise is to increase the dorsiflexion of your foot, especially active dorsiflexion. So what we're going to do is we're going to use the dowel as a support to the inside of the knee to make sure it doesn't cave in. And what we're going to want to do is we're going to really go forward, bring the knee over the foot as far as we can to emphasize on that dorsiflexion. So we want to decrease this angle as much as we can, hold that for 2 to 3 seconds at the end range, go back to neutral, and then back into it. And we're gonna do this 10 times for 2 sets. Now that I've run you through the assessment and treatment of IT band syndrome, and you may be experiencing those symptoms, or you have IT band syndrome and have sought care for it and haven't gotten relief from it, pick up the phone and call us at 561-997-8898 and get scheduled for an evaluation and treatment on the same day.